Good evening, everyone. I should literally be starting in the next 2 minutes. I'm just setting up the YouTube channel, so just give me 1 second and let me just get that unmuted. Good evening, everyone. I should literally be starting in the next 2 minutes. I'm just setting up the YouTube channel, so just give me 1 second and let me just get that unmuted. Right. Can I just confirm that you folks can hear me? Can everybody hear me? Can someone just write on the chat if you can hear me? Let's just share this key. Obviously, if you're applying, then definitely you can. Yes, yes, yes. Okay, amazing. Brilliant. That sounds like an absolute plan. Look, we've got literally 3 minutes to go, and there's absolutely a lot to cover. And there's going to be a lot of you folks here. So it's going to be absolutely amazing, and we're going to have a great time. I'm just going to set my slides up and let's pretty much get this started. So the agenda is fairly straightforward today in that we're going to be starting literally in the next couple of minutes, and we intend to finish on time. And I've actually had some wages put on this that I cannot finish a webinar within 45 minutes. So hopefully I'm going to plan to finish this within 45 minutes. That's basically going to be the plan. And someone said that the chat has been disabled, which is really bizarre because it's not normally disabled. So I'll write something down and just let me know if you lot can reply to this, because it's a bit bizarre if the chat's been disabled. It's not normally the case, but if it has, I do apologize. You can essentially ask your questions in the Q&A, I guess. You could write it in there. So I do apologize if that's been disabled. So I'm sorry about that. But you can actually answer questions, and I can see you writing questions in the Q&A. So literally, we've got, a couple of 60 seconds to go. What I'd like you to do is please make sure, yes, Asad. So everybody who's writing questions in the Q&A, I am getting them. So, everyone who is here today. So who do we have? We have Asad, we have Baraj, we have Eddie, we have Kenny, we have Madhya, Maria, Muhammad, Nada, Rita, Rubja. So there's going to be a lot more people who are going to absolutely be joining us as the webinar goes on. And any questions that you put on there, I can see. I request that you write your questions that you have specifically on there, because I intend to spend 45 minutes and try to wrap this up. Now, having done this previously, there is actually a recording of a similar webinar that actually lasted for an hour or 2 hours on the YouTube channel. I said it's on the YouTube channel. It covers everything. So if you go onto Medlearn and YouTube, that's MEDLRN, you will see that down there's the YouTube channel. And on there, I did a 2-hour webinar with Locate a Locum where I absolutely covered everything. So hopefully I don't miss anything today, but if I do, it is definitely on there. Because my understanding is, having done this for a very long time, what you folks actually want to know is you folks will want to know, how do I find a DMP? How do I get HEE funding? And you'll also want to know about the application process. And maybe some of you might also ask about your scope of practice. So that is what I'm going to go through without going and spending too much time on the history of prescribing, because I can definitely not get it done in 45 minutes. I had 67 slides. So you can imagine with 67 slides, even if I spent 45 seconds on each one, it's impossible for me to finish it in 45 minutes. So I'm going to skip a lot of the stuff that's not important. So everybody, welcome to this webinar. For those of you who don't know me, my name is Fahim. I'm a pharmacist prescriber, contractor, founder of Medlearn. And today we're going to be delivering this wonderful webinar to explain to you exactly how you become an independent prescriber, how you get Health Education England funding, and how you find a DMP. And that should also help you to find out how you get the best out of your course. Now, first of all, welcome to everybody who's here. I'm just going to shout out some names. So we have Alex, Aliyah, Asad, we have Balraj, we have Caroline. So we've got plenty of you folks here, which is brilliant. And, oh, this is weird. My screen has just stopped. Has my screen just stopped? No, it hasn't. Bizarre. It kind of just stopped. But there's plenty of you guys here today. So I can't go through all of them. I do envisage a lot more coming through. So let's pretty much start to move on and crack on with this. So what is our vision? Our vision is fairly straightforward. We would like clinicians like yourself to be the best versions of yourself and to be inspired to not only make a difference to your lives, but the lives of your patients, your family, and for us together to build a better world. I do feel that God has given us a great opportunity and we should utilize that chance to make the best out of everything that we're trying to do. So that's essentially what we're trying to do here today. Our vision is, irrespective of who you are, age, gender, race, beliefs, that you are given the best healthcare that's available, and it's delivered by individuals like yourself who are here today, who are inspired and fulfilled by what they do. That is what we want to achieve. And how we're doing that is by upskilling the workforce, is by giving you the best opportunity to be the best versions of yourself. And essentially what we're going to do today is to make sure that at the end of this 6 months training, you're not only benefiting financially, but you're also able to help patients as well. So I want to be able to make sure that we can deliver both of that today. Unfortunately, Sarah, who's from Locate a Locum, is not here. I just want to thank Locate a Locum for everything that they're doing. They're absolutely being very proactive, and they have a similar vision to us. And that is that they want to upskill that workforce and to power or empower you folks to be able to, again, in a nutshell, be the best versions of yourself. And they're very, very proactive. They don't just want to be a locum agency that's just giving locum shifts. What they want to do is to build a network of pharmacists who are inspired, who are fulfilled, who have education. And that's why they're partnering up with some of the leading providers in this pharmacy space to make sure that they can do that for their locum. So thank you very much for Locate a Locum for making this happen, because I just think it's amazing for a locum agency to not only give you locum shifts, but to help you become prescribers, give you the tools that you need. I think that's absolutely amazing. So Sarah, who's not here today, has been amazing to orchestrate all of this. So thank you for doing that. So that's a bit of words about Locate a Locum. What do we want to do? I want you folks to understand how to become a prescriber. We might have to skip about unlocking your potential because we've only got 45 minutes, and also how Medline can help you. So I'm going to start skipping through stuff that I felt is not that appropriate. Yes, the questions that you folks normally ask is, how do I find a DMP? Which university should I go to? What to expect on the course and how to fill out the application? And obviously the new one is HEE. Oh, that's HEE. Sorry, I'm losing my marbles. Okay, HEE funding. HEE funding. Now, is there anything on here that's been missed? Can you write it in the Q&A, anybody? Is there anything that I've missed here that you wanted me to cover? Is anything missed there? If I cover how to find a DMP, if I cover the university application, what to expect on the course and how to fill it out, and HEE funding, was there anything I missed that you guys are desperate for me to ask? I don't feel clinically relevant for prescribing. Okay, so you're talking about developing your clinical skills. I would try to touch on that. I said, no problem. Anybody else? Any question? I'm going to give you count till 10. Write it on there if there's anything that you felt, actually, Fahim, I need you to cover this today. So we'll do a countdown. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. The new GPC guidelines for newly qualified, good. Do we need to do IELTS? Okay, good, fine. As I'm speaking, keep putting your questions on there and I will definitely try to answer them. Okay. I'm going to ignore this slide. This slide was basically telling us about pharmacists and their struggles. So one of the areas that the struggle is that they felt, I mean, the CQC had an issue with prescribers, and you all know some of the issues that have been going on in the pharmacy space about not safely prescribing. You've all heard of the GPHC clamping down, the CQC are clamping down. There's a lot of stuff that's going on there about prescribing and doing it safely. This was just a slide summarizing that about the issues that exist. So we don't need to spend our time too much on this. I'm not going to give you a lecture about my history. We're not going to spend time about what I've done. If you really want to find out about me, I've done it, said it plenty of time on YouTube, LinkedIn, whatever, we can do that. But it's not about me today, it's about you. So we can skip this slide as well. It's not relevant. This slide is important. What I need you to understand in a nutshell is the prescribing course was designed for nurses. Understand this. And what nurses were doing, you've got nurses who were seeing patients. So you imagine this is a patient right here who was seeing patients. We're going to do a stick man here. They were seeing patients and they were then saying to the doctors, write a prescription. And the doctors were then writing prescriptions. What is the issue with this format? What's wrong with this? What's the issue? Someone write it as a question by all means. What's the issue with the nurses doing the diagnosis, calling up the doctor and saying, hey, Dr. Madhia, write a prescription for nystatin because he's got a fungal infection? What was the problem with this? Someone tell me what kind of issues do you see with this kind of thing happening? If If somebody else is doing the diagnosis, correct. So there's a couple of issues. One issue was who's actually responsible. Is it the doctor who's responsible, or is it the nurse? Number one. Number two, what you need to realize is nurses had a lot more experience. Let's be honest, as pharmacists, things are moving faster now, but prior to this, we were doing a lot of stuff behind the counter. We weren't examining patients. We were not taking thorough histories. We weren't having that clinical experience. It's not that we're not capable. Absolutely, we're capable. We don't have the experience. Nurses actively are dealing with patients and seeing. And I'll tell you something, as a medical student as well, I'm a medical student as well, I will tell you the only difference between a pharmacist and a medical degree is exposure. Nothing else, okay? I spend a lot of time on anatomy, physiology, biochemistry, because I teach it all the time. Majority doctors don't remember any of that. What they are good at is experience. Experience. So what separates a pharmacist within his skill set, again, I'm clarifying, I'm not trying to say that a pharmacist can do everything, neither can a doctor do everything. But within your skill set, the only thing that's stopping us is experience. Within our remit is just having that experience. So this course, why you need to understand this is because the university course does not teach you clinical skills. It doesn't teach you clinical skills. It's not designed to teach you clinical skills. So if you think, actually, all I need is to find a DMP and I'll do my course, university will teach me everything. No, no, no. They will make you sign and say that the area that you're choosing, you have the pharmacological knowledge, pharmacodynamics. You understand everything about the disease state, and what you're doing now is demonstrating to us that you're safe. Reading University, for example, when you do their application, they actually do an interview now. And one of the questions they ask is, hey, Madiha, and I'm not picking on you, my dear. Hey, Madiha or Waralu, you're studying for diabetes. Tell us about the diagnosis. Tell us about the management. What drugs are going to be used? Tell us about diabetes. Because they want to make sure, okay, actually, if you're doing this course, you've got the clinical skills. You're not getting away with just saying, hey, I just pick any topic and I'll get my qualification. Those days are gone. The reason is because the university courses are not designed to teach you clinical skills. And pharmacists are gaining these qualifications. And quite frankly, some of them are, and we've all done this, they are, unconsciously incompetent. They don't know they're incompetent. They think, okay, what's so difficult? It's like dentists, right? I used to joke with my brother at one point, and he used to say to me, hey, dentists, all they give is just amoxicillin and metronidazole. Next time we have a dental infection, you're a prescriber, just prescribe that. And I said, look, you're only seeing one part of the story. You're not seeing everything else that happens that a dentist does that isn't metronidazole and amoxicillin. Does that make sense about being unconsciously incompetent? Sometimes we can do stuff, we don't know what we don't know, but we think it's safe. And that's the problem with what's happening with prescribing is we're qualifying, they're getting this. And the reason is because they're not understanding that the course does not teach you clinical skills. I hope that's made sense to everyone and that's clear. And again, you could take a picture of this slide and do research, but I've talked about this in a lot of depth in another webinar, so I'm not going to spend time going in this. So we're going to be talking about this, how you become a prescriber. First of all, finding a university. Let me tell you something about universities. My advice to you is, first of all, go with a university that you have a relationship with. Always a good thing. So if you studied in UCL, think about UCL. If you study in King's, think about King's. Why? Because you're an alumni. Makes it easier. Secondly, think about whether that university has funding or not. HEE funding. And we'll discuss that in a bit more depth later on. So think about funding. Also think about if they don't have funding, this is written terribly, if they don't have funding, think about how much they're charging you. And most courses range between, I've seen up to 3,000 to, so be £1,500 to £3,000. And they're all covering the same things. Some are more academically stronger. I feel that they're a lot more strong on the theory side. Some are not that strong on the theory side. So if you've got any particular questions about a university, I can't obviously discuss it here. Get in touch and I'm happy to give you advice. But these are things that you're looking for. So Fahim, if I'm looking for a university, what am I thinking about? Number one, think about my previous experience. So I've been there. Number two, think about HEE funding. Number three, think about, are they a school of pharmacy? Why is that relevant? Because if they're a school of pharmacy, then they know what the needs of a pharmacist, so it makes it better. And number four, advice. Get in touch with myself, get in touch with other colleagues, ask them how was the course. So these are things that you're going to talk about in terms of finding a university. A lot of students, and another thing, if they're delivering courses online, is it online or face-to-face? A lot of pharmacists that I'm helping now, a lot of them prefer online studies because it's convenient. It's convenient. The same thing, other than practical skills, I do feel a lot of stuff can be delivered online. We can siphon that out. So again, these are things that you want to think about when you're looking to think about which university to go to, okay? And we'll look at the application form and process in depth. I'll cover that. And let's talk about finding a DMP. Right. Okay, wait, we'll come to that in a second. Let's move on. First of all, here's a step-by-step guide. All you do is you go to Google, type in pharmacist prescribing course, click on this link, and you'll come across courses that are accredited for pharmacists. Another question I get is which level? Guys, you need level 7. You need level 7. Level 7 pharmacist. It's master's level. You're a master's level student. You have to select level 7. Why? So I'm not going to spend too much time in levels, but it's to do with credits and number of hours of study. But I'm not teaching you to become an academic, but just take it from me as a pharmacist, you have to do level 7 because you're already a master's level student. So not level 6, not level 6. Also, some universities are offering a clinically enhanced course itself. You know, in my opinion, a 6-month course at level 7 is all you're looking for. You don't need to burden yourself extra by doing all these clinically enhanced stuff and blah, blah, blah. But definitely, if that's a choice, we can discuss it. You can obviously find out what the benefits are. But a level 7 course for 6 months is all you need. Type this in Google. Look for courses that are accredited by the GPHC. Don't click on any random courses. Some courses do offer a prescribing course, but they're not accredited by the GPHC. Some courses, for example, for nurses that are accredited for pharmacists are not accredited for nurses. So far, you're all with me. Someone give me a thumbs up or tell me you guys are all cool. Everyone's understanding. Are we all cool up till now? Are we all okay for now? Perfect. That's fine. Thank you. Perfect. Loving it. Okay, Asad, great. So everybody is up till now. Beautiful. Right. Next one. Here's a list of universities. Here is a list of universities that come up. And I have worked with majority of these universities. So I've worked with Birmingham, Reading, King's, UCL, Robert Gordon, Salford, Coventry, Cumbria, Aston, Birmingham, Wolverhampton, DMU, Sunderland, Medway School of Pharmacy, Plymouth, Buckinghamshire, pretty much all of them. Cardiff, I have worked with absolutely all of them. So I know who the doctors are. I know who the teachers are. I know what the course is like. And a lot of the teachers that actually teach on these courses also act as consultants with Medlearn as well. So that's why, you know, we've got great relationships with a lot of these universities. And I want to do a special thank out to Birmingham University, Salford, Aston, Reading, UCL, Lizzie Mills is one of the consultants who works with us. Wolverhampton, you know, folks, thank you for all your support because it's wonderful working with some of you clinicians. So thank you for that. So that's the list of universities. Right. In terms of filling out the application form, okay, let's start to look at this, what happens. First of all, what happens is when you look to become a prescriber, the first thing you have to do is you've got to find a university and you have to have a doctor or a DPP. We'll discuss that in a second. Okay. You cannot apply to university without those two things. These are the requirements. Number one, requirement number one, you've got to apply to an accredited university. Number two, you need access to a DPP/DMP. And now a lot of students are asking me, hey, Fahim, but the law has changed. I don't have to be qualified for 2 years or whatever it was. That is correct. However, the GPHC have not given the universities guidelines on how they're supposed to take in students who have been qualified for less than 2 years. Let me explain that again. One of the requirements going back a year or so ago was that a pharmacist had to be qualified. I believe it was for 2 to 3 years. I can't remember exactly. Yes? Now that law has changed. However, the GPHC has not told the universities that this student who's only been qualified for 2 months, this is the criteria he needs to satisfy. That might be, for example, he needs to have done this much CPD. You've got an interview with him. That's why a lot of the universities are not accepting students who have been qualified for less than 2 years yet. Have I made that clear? The law has changed, but definitely by January 2023, I think that's all going to be clarified. Does that answer your question? One of you had the question about this, about the GPHC summer. Does that answer your question? So by January 2023, it should do that. Yes, and some universities at Manchester, like I said, yes, Manchester, Wolverhampton, Some of them can. Cardiff are taking newly qualified. So some universities are taking on. You just got to get in touch with them. Okay, so someone, thank you for that information. Someone's explained to you that Cardiff, Manchester, and I know a lot of the universities are taking on students for next semester, but that answers that question. I hope that's clear. But with that being said, you need to find an accredited university and a DPP. Accredited university, you're going to find the GPHC venture side. Now we're going to find out and discuss about finding a DPP, DMP. Look, number one, in order for you to find anyone to help you, you have to build relationships. Okay? Why you folks are here today is because either you know about me, or you've heard about me, or you know about Locate Locum, and there's a brand in place, there's a relationship. That's why I will do things for you, and you will do things for me. Simple as that. You can go down the route like I did, where you start cold calling and sending cold emails. You can do that. That would be one way, and I'll show you what email to type. One way would be that you literally start cold calling, where you get an email, okay? And yes, Habib, it will be recorded. You can get an email, and I'll show you how to draft out the email, and you can send it to all the practices. That's one way to do it, where you literally cold call. The other way would be where you call some of the surgeries and ask to speak with one of the doctors and introduce yourself and say you're looking to do this, and is this something that I can help with? Another way would be that you say, look, I want to do this. I'm happy to also give some of my time in return. In life, other than when you spent time in your mother's womb, when you were an embryo or you were a zygote, you never had a free lunch other than then. Agree with me, guys, in life? No one gives you a free lunch anymore. Everybody expects something in return, whether it's a relationship with your parents, your wife, your sister, blah, blah, blah. That's life, okay? It's the same thing with finding someone to supervise you. I'm not saying that there has to be a monetary exchange. I didn't say you have to pay for it. What I'm saying to you is anybody who acts as a prescriber will possibly want something. You have to build a relationship. So number one, you could do is say, right, for him. One thing I can do, draft out email and cold call. So you literally blast out an email and send to all the surgeries. Somebody will say yes. You know, it's not a smart way, I guess, to get married, but one of the ways would be that you go to every man or woman out there, will you marry me? Will you marry me? Will you marry me? Will you marry me? Okay. Maybe you'll find someone who'll say yes. But as you can see, you're not building a relationship, right? It's like you're on your first date and you just talk about yourself. You don't build a relationship like that. That's number one. Number two would be speak with doctors. So maybe when a doctor calls about a certain thing, you can introduce yourself. My name is Fahim. You know, doctor, I'm really struggling to find someone to supervise me. Can I have an email address? I can send you some information over. I want help with this. That would be one thing. Okay. Another way would be is you could ask friends and family, but be careful. Be careful with what's the word I'm looking for? I hate saying the word. Be careful with. It's going to come to me. It's going to come to me. Be careful with conflict of interest. A lot of universities will ask you to be careful with conflict of interest. So family definitely won't be accepted. Friends can be accepted. Family, they'll say conflict of interest. If it's your sister, your mom, your dad, whatever, you know, they can't act as your DMP, there'll be conflict of interest. But the other thing, guys, there's another thing. It's not just about finding a DMP. It's about someone giving you value. Your time that you're spending with me today is worth more than $1 million, because you can make £1 million, but your time will never come back. So if you're going to spend time with someone, make sure that they're giving you value in return. Doesn't matter about anything else. If you're my doctor friend, are you actually able to teach me? Are you able to give me what I require? That's important. So someone's asked, can my GP friend be my DMP? Yeah, it can be a GP friend. It can be a partner. It can be anyone. But the thing is that you need to make sure they're giving you value. Do not do the mistake that I made, like a tick box exercise, that I just want to get a DMP, get my course finished, because you're going to be back in touch with me in 6 months saying, now teach me. Keep that in mind. Okay. Right. So far, do you have any questions about finding a DMP? Medlearn can organize it for you. We'll talk about that later. Okay. But somebody's raised their hands. Let's have a look. Someone has raised a question. Write it in the chat and I'll answer it for you, because if I let you lot all talk, we might be here all night. So write it in the Q&A. I'll answer it quickly. Everyone start typing. If you've got any question about finding a DMP, we can organize it for you. But if you didn't want to go down that route and you said, I'll try to find myself, you can write it in the Q&A. What's your question? How long that DPP should be qualified for as a GP, many years of experience minimum. No. So GP is not a problem, but we're talking about doctors. We'll talk about pharmacists later and other people who are not doctors to become. I'm going to touch on this topic. Look, I'm a big advocate of pharmacists training pharmacists. I'm a big advocate of that. However, if you are going to have a pharmacist train a pharmacist, my first thoughts is we're not building a multidisciplinary team. If you're learning from another clinician, do think about how you could learn stuff from a dentist, a nurse, from a different mindset. That's the first thing. I always like to work with others because I can pick things up differently. I already know I'm a pharmacist myself. So as much as I can learn a lot from you, but it'd be great to see how a doctor thinks, how a nurse thinks. That's the first thing. Secondly, if you are going to get whether it's a pharmacist or a doctor to supervise you, ask them, how many pharmacists have you trained? And can you teach? A lot of doctors can't teach. The reason they can't teach is because they've never taught before. It's just like you guys, when you did your pre-reg, you'll know so many pharmacists who became your tutors who can't teach, who don't know it themselves. So that's the point. It's not just a case of finding a DMP. Can they teach? Have they taught before? How can they support me? In terms of experience, my advice to you is a GP is not an issue, but for pharmacists, they have to be qualified for at least 3 years. But my category is straightforward. Pharmacists, have you trained others before? What experience do you have? And are you the right person for me to learn from right now? Would I get more value in learning from a different professional who does it day in, day out, who's an expert in this field versus another pharmacist? So that's the thing that you've got to ask yourself. These are the questions that you've got to ask. Does the GP have to take permission to be my DPP? He doesn't need permission from anyone, but he might need permission from his partners where he works, because if they're paying for his time, then they might turn around and say, actually, you've got a student in place, why should we train? So he doesn't need permission, but there is an interview process for GPs as well now, because a lot of doctors and other people were acting as DPPs. They weren't giving value to pharmacists. The universities are clamping down on this now. They're actually blacklisting some clinicians who shouldn't do it because they're not safe. So now the interview, actually, if you're going to be a DPP, do you know what's involved? Keep that in mind. It's not that straightforward as finding any doctor. And again, that's one of the things that we can help with. Right. Any questions about DPP? Anybody? Anybody can act as a DPP, but think about it. Look, if you're the NHS, where are the NHS struggling? The NHS are struggling with patients who are coming for acute conditions that could be seen by doctors, or let's say somebody's got head lice, and that could be seen by a doctor, but instead they're ending up in hospital. What I'm trying to say to you, a dermatology is too specific. Try to do something more generic. You'll find that more useful. Don't specialize immediately. Try to do something at the NHS. Where's the NHS struggling? Minor ailments. They've never said there's an issue with dermatology. There is, but the majority of people end up in hospital for these minor illnesses. So remember, with the universities are also going to screen you as well. The university are also going to screen you as well. So keep that in mind. So my advice to you is, in terms of your scope of practice, stick with something like a minor illness. You'll find that quite useful. Also ask yourself, how many patients am I going to see? Ask yourself, how many patients am I going to see? Do not pick a condition that you're never going to see. For example, let's say you pick dermatology and you picked something like, I don't know, a weird and wonderful conditions like, let's say, I don't know, let's say lupus, and you pick lupus. In your setting, how many patients are you going to see with lupus, and how useful is that to you? Instead, maybe eczema would be quite useful for you, because you're going to see a lot of patients with eczema, even as a pharmacist. Maybe something like acne would be quite useful for you. Maybe something like an earache would be quite useful for you. A chest infection, possibly. But stuff like when especially community pharmacy, when you start to pick stuff like asthma and hypertension, folks, be honest. Are you going to be taking bloods? Are you going to be doing ECGs? No, you're not. You're not going to be doing that in your setting. So it's not beneficial. Afterwards, you can learn that and you can specialize in that. For now, stick to something that you're going to be seeing a lot of. For example, ear infections, throat infections, skin infections. That's what I recommend to you. But if you're working in a community pharmacy, you say, I'll do hypertension, you're making a mistake, because you're not going to see patients on hypertension, and the university will clamp on this. So wait a second. How are you going to do your essays? How are you diagnosing this patient from start to finish? You're not even involved in the entire process. Does that make sense to you all? So that's something I wanted to mention about that, about choosing your scope of practice. I'm getting really annoyed because I know I definitely can't do this in 45 minutes. And there's so much to tell you. It's just crazy. Right, let's think about the questions itself. So when you fill out the application form, this is what the application form looks like. It's fairly straightforward. In actual fact, you know what? Let me share my own screen. Let's pick out some application form. Let's check. I've got an idea. Right, let's actually pick out an application form. Let's pick out an application form. Let me pick out an application form right now, a standard application form that we can pick out. Yes, okay. Right, everyone, let's do this. Let's do this. Here's an application form. Let's go through this together. Can you all see the application form? Someone tell me on the chat, you can see the application form. Guys, quickly, we got very short time, and apparently I've actually got a bet on that I can finish this webinar in 45 minutes, which I don't think is going to happen. Can you all see the application form, right? You can see my screen. Yes, okay, look. Right, let's go through this. The first thing is fairly straightforward. All of you know you can pick what university you're applying to. Some universities ask who's funding it. Is it your employer or is it Health Education England? Now, about funding. The Health Education England have got funding places that are automatically allocated to the universities. You don't have to do anything specific. You just have to tell the university that I'd like to apply for funding. Then they will allocate funding to you. You don't have to do anything specific. But the funding is definitely going to be down to your application and whether they feel actually you're also adding value to the NHS. I do really feel that. I do really feel that there is a screening process. I do feel there's a screening process. So as much as it's first come, first served, but if you've got someone who's doing, let's be honest, right? You've got two candidates. Candidate one is doing his prescribing in Botox. Candidate two is doing his prescribing in an earache that the NHS is struggling with. You tell me, where do you think the funding is going to go? Tell me. Is it going to be for Botox? Or do you think the NHS might say, hey, this guy might be quite beneficial for us? Let's be honest. I'm not saying that's the case, but if you were in those shoes, you tell me which one you'd be swayed towards. Botox or someone who's doing it in a minor illness that could help the NHS. I'm not saying that's what happens. I'm just telling you that be pragmatic. Are you all with me? Be pragmatic. Think about it, okay? Just be pragmatic. That's what I'm saying to you. But the Health Education England funding is done centrally. I think personally that your application form is quite important and also first come first basis. And the funding is allocated up until March 2023. After that, we don't know what's going to happen with the funding. Have I answered the questions about funding? Is it clear? Everyone, you can write it in the Q&A. The funding, you don't have to do anything. You'll just tell the university, but it will come down to, in my opinion, it will come down to your application and whether or not you're a candidate that's suitable. Are you all with me on that? I think you are. I think you are. So that answers that question. Then it's your personal details. I don't need to help you with filling out your name, your date of birth, your title, your date of birth. This is all easy, right? This is easy. This is not rocket science. Let's move on a bit further down. Your job title, is there anything difficult here? I don't think so. Nothing here. Applicants not born in the UK, they don't normally ask for IELTS. One of your colleagues asked the question that, do they ask for IELTS? Not normally. If you're already a registered pharmacist, IELTS shouldn't be a problem. Every university is different, but IELTS should not be a problem because you're already a qualified pharmacist. So it should not be a problem. I think they might ask you what your university was studied in terms of, what your course or language was studied in. But if you are, you don't need to do IELTS at the top of my head. Okay, but obviously you can get in touch with the university, but I've not come across anybody, and we've helped hundreds of students become prescribers and organize the doctors for them, that they have to do IELTS. Okay, so I hope that's answered that question. Then it's going to ask stuff about your university. Some universities do require you to have two things. They might require you to actually have an actual passport, a degree. So make sure you might need that for some university. Also, some universities would require two references. One academic reference from the university. And to get an academic reference, you simply email university, the help desk, and say, hey, I used to be a previous student. I need a reference. Could you write a reference? And they will do it for you. University will just do it for a generic reference. They'll write. Okay, keep that in mind. Then there's stuff about your qualification and so on. Right. Again, this is easy about criminal conviction. Like, I shouldn't need to help you with this. Your personal statement, man, this is so important. This is so important. Your personal statement is so important. And we help students all the time asking them how to write a personal statement. And one thing you need to remember about your personal statement is you need to link policy. Think about the NHS long-term plan. Think about when you're writing your personal statements, think about things like the future of the NHS, the changing in the pharmacy profession. Think about all these things when you write your personal statement. And that is very, very important in terms of writing your personal statement. So you want to think about linking. So talk about things like how you reflect on your practice. They want to hear words like reflection, that I reflect on my practice. And we all reflect. For example, you're thinking, you're watching me do this webinar, you're thinking, how did the webinar go? You might be thinking about what's his haircut like? You know, what did he speak like? How did I perform? Everybody reflects. So how do you reflect on your practice? Think about things. A multidisciplinary team, they're always looking for words that you've been engaging, you being part of a multidisciplinary team. Then also think about policy, link policy in there, the NHS long-term plan. Think about the NHS workforce deployment plan. So these things are also important. They want to see that this person actually knows what they're talking about. Okay, so that's where this becomes quite important. Anybody who's struggling with writing their personal statement who wants help, that is something in all our courses that we help with. We can help you with this entire process, but I just wanted to touch on a bit about this in terms of writing your personal statements and so on. Okay, so again, it's quite serious here. Talk about continued professional development. They want to hear that you're reflecting. They want to hear these words. The key words they want to hear is CPD, reflection. They want to hear words like part of a multidisciplinary team. They want to hear words like constant learning. They want you to link policy. So the NHS long-term plan, stuff like the workforce development plan, and so on. That's what's going to be key things for you to write about and also your history, like why you want to become a prescriber. You'll talk about taking pressure off NHS. Talk about shortage of doctors. Talk about the future of our profession. So you can see that's quite important. They'll also want a reference. So your reference, you could have, if it's a professional reference, it could be any friend, like a friend that you know, or if it's an academic reference, it has to be from the university. That's about the personal statement. And I've gone through this in my other webinar in a lot more depth, and we help you with this from start to finish. Then it's fairly straightforward. It's a tick box exercise. Look at that. It's a tick box exercise. And this is where someone needs to vouch for you. So someone has to tick that you can do this. This is really straightforward. It's basically, again, what they're saying is this. Have a look. Look at this. Can you see? Very straightforward. That they are eligible to take the course. They have the necessary qualifications in place. They have the clinical skills. Look at this, numeracy skills, and they've got the necessary qualifications. So they're making you sign. If you're doing this course, mate, you need to know everything clinically. Look at this. Look at this. What is this? There you go. It's clear. They've made it very clear that you better have up-to-date clinical, pharmacological, and pharmacological knowledge. It's not their problem. We're not teaching you clinical skills here. You are signing on this dotted line to say, right, I have the experience. I can do this course. And this your manager has to sign that you can do this. So that's why, again, they're not teaching you clinical skills. It's not their headache. It's your responsibility. I hope that's clear. So far, any questions about this application form? Let's be honest, guys, we're not going to finish this in 10 minutes, even if I tried. Questions? No, but you raise your hands, write it in the Q&A, guys. Write it in the Q&A, because if I let you unmute your mics, we're going to be here till probably 10 o'clock at night. So write it in the Q&A. Then what they want is for someone to vouch for you that you're going to get 90 hours of supervision. That's what they want. They want somebody to vouch for you to say that you're going to get that supervision. That's important. Okay, so again, that's someone just signing for you. Your manager can do that for you. Locums, I get this by a lot of locums. I'm not a regular pharmacist. Try to speak with someone who you locum with. You've got a good relationship to support you on this, because they don't like locums. They don't like locums working alone because you have no support. You're not building a relationship. So locums can do it. They don't have an issue with locums. But you think about it yourself. They want to see that you've got someone supporting you. So maybe a smart way would be to get in touch with the regular place that you work at, anybody you got good relationships with, and see if they're willing to support you. So there's no issues with locums, but I think the issue is that if you're working totally independently, who's going to support you and give you that training other than your DPP? That's why as a locum, my advice to you is get in touch with those who you work regularly with and say, look, are you happy to sign with this? Okay. You can do it yourself as well, but you can see they're asking for line manager and it can cause a problem. But if you're unsure how to tackle this, we can help you. So at Medland, we will organize your placement for you. We will act as your agency to support you to become a prescriber. So we can do that. But this is quite important. Okay, if you don't have that support, you get in trouble. DBS, everybody's DBS has to be enhanced. DBSs can only be requested normally by employers. You can't just get a DBS done. It has to be an employer that can request it, okay? So you have to get your employer. If you're working with a locum agency, they can do that for you. Someone has to request it for you. And then the line manager has to sign. So again, seriously straightforward stuff here. Then this is your information about your doctor, his name, his clinic experience, his title, his qualification, all his information, and the fact that he's going to agree to supervise you for this period of time. He has to sign. Signature. Right. Then again, the doctor has to take. So you're looking for, is he a GP? Is he on the specialist register? Does he reflect on his practice? Has he got at least 3 years of relevant clinical experience within that area? Has he, look at this, has experience teaching and supervising in practice. So now they're clamping down on this. So just any Tom, Dick and Harry is not going to work. I say the word Harry, but one of my good friends is called Harry. So Harry, I'm not picking on you, but yeah, that is just, it is what it is. So these are the requirements. So a GP is fine. A non-medical prescriber, again, that's the requirement. Has he experience teaching? Does he reflect on his practice? Is he in good standing? That, I hope, answers that question. So far, guys, am I answering your questions? Yeah, Sadiq could absolutely, locum should have this. And I know, you know, there's, I think Tawhidul is organizing DBSs, but you can get someone to organize that for you. I know locum do that as well. There's a lot of people who can help you with a DBS check. There's a company, if you don't mind, you know, I can give you the name. I think it's dbscheck.co.uk, but your employees would have to do that. And it has to be enhanced, okay? That's quite important. You don't have to worry about numeracy, thank God. We don't have to worry about numeracy. Keep that in mind. DPP, so if you're not a doctor and you're looking to become a prescriber, look what they're asking for. Have you supported before? What's your ability to assess? Because look, guys, I'm just being honest with you. At the moment, you know, as pharmacists, yeah, I guess a locum company could act as a line manager, someone to vouch for you. Someone has to vouch for you. So I guess, yeah, it can be done, but someone has to vouch for you that, look, this person is what they're saying. But my advice to you is, you know, build relationships, build relationships with people, you know. Yeah, a DBS 1 to 2 years old is fine. So normally it has to be within 2 years, I believe, but don't do it more than that, okay? So again, if you're looking for a pharmacist or nurse to act as your prescriber, look, it's straight up. They're asking these questions that what gives them the right to teach? Have they done it before? Because ultimately, let's be honest, you're trying to teach a pharmacist what a doctor does day in, day out. Let's be honest with you. That's what you're trying to do. And the truth is, I was having a conversation with Nick from Health Education England, and there's not enough doctors. And what we're trying to do at Medland is we're also trying to train pharmacists who teach with us to then also act as DPPs, and then we reimburse you. So what we do, we will take on a student. We will organize your doctor for you. We will train you for 1 year to be able to manage, diagnose, treat disease, everything start to finish. And then we will also train you to be able to train other pharmacists for which we can then pay you to work with us, because I know there's not enough doctors. And as a final year medical student and blah, 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 one thing I will tell you is, for me, we are looking for students who want to learn. It's not for everyone. I don't take on every student. We are looking for students who say, Fahim, I want to learn. I want to be the best of the best. I want to be safe, teach me. And we take you on for 1 year. That includes organizing your doctor for you, helping you with the application form, finishing your clinical skills training, teaching you for 1 year. And then if you're good and want to learn, preparing you to then work with us to take on other pharmacists so they can do it. Because people are struggling to find that there's not enough doctors. There is not enough doctors. Okay. You can use up-to-date service for DBS. It's perfect. You can do that. It's not a problem. So that's what we're doing, okay? Keep that in mind. Because I also know there's not enough doctors to take on pharmacists, even if I wanted to. Then it's about the practice. They have to be registered, possibly with the CQC. That's quite important. Human resources. So a lot of universities are not happy with pharmacists working in community pharmacists and then acting as DPP, because they're thinking, right, what sort of experience are you going to have teaching another pharmacist? So they do look for CQC registration. So traditionally, GP surgery seems to be the one. Okay, so these are simple questions that they've got governance in place, and okay, fine. Number one, a lot of you ask me, what does the doctor have to do? Number one, there's a lot of academic stuff involved. He has to do paperwork with you. He has to also help you with your course. Number two, he has to supervise you for 90 hours. Number three, he has to attend regular meetings with the universities. And when you start telling this to a lot of doctors, they're thinking, forget that. So these are things that the DPP has to do. Number one, he has to teach. Number two, help you with course material. Number three, he has to meetings with uni and student, normally 3 to 4 in 6 months. And he also help you and sign you off and read your essays and paperwork and so on. So you can see when you're going to go to a GP and say, right, mate, this is what I want you to do, a lot of them will be like, we're okay. So not only are you asking for 90 hours, you need help with the course, you need to have regular meetings with the surgery, sign off, reading essays and paperwork, give you feedback. Nah, I'm all right, I've got too much to do. That's what the GPP has to do. And that's what they're signing up to. So if you're paying people, then you need to make it very clear, mate, this is what's involved. I'm happy to pay you, but this is what's involved. Are you happy to do that? So that's quite important. For NMCs, they require a designated supervising practitioner, and some universities are also requiring this. So there's a DPP who's overall in charge, and there's someone who works with you on a regular basis, and they call this a DPS, a designated supervising practitioner, or prescribing, or designated supervising practitioner, or I think it's designated prescribing supervisor, whatever it is. That's something that sits underneath. He's the kind of person who's with you day in, day out. Think of it like your pre-reg. You had the pharmacist who was over in charge, who was your tutor, and then below that you had the regular pharmacist, the local pharmacist who's working with you. So some university nurses have to have this, but some universities also require this now. Right, I actually have a feeling that we're not going to do this in 2 minutes. Oh well, tough. I've lost the bet. Then what they want is who's going to be vouching for you is they want this. So if you did have a locum, so somebody asking a locum company be a line manager, yes, but then you're going to get stuck because they want the non-medical prescribing lead. Who's the lead in that area? What they're asking you is, if you're going to become a prescriber, who is actually going to be vouching for you, supporting you on this journey? If you're going to become a prescriber, who is actually going to be vouching for you, supporting you on this? Who's the non-medical prescribing lead? This is where you're going to get stuck. You see, as a locum, somebody has to support you. Does that make sense to you so far? Everybody? Am I with you? Is there anything I've missed off so far? I hope you've got the information that I'm giving you. Anybody got any questions? Right. Anybody got any questions so far? I think you guys are doing well. Brilliant. Okay, we can move on. So you know what? I just feel that I need 2 hours to do this, but I'm not going to be able to do it in 2 hours. That's for sure. I know that for a fact that I will struggle to do this in 2 hours as much as I try. I don't think I can do this even if I wanted to in that much space of time. Right. Okay. Okay. Move on. Let's move on. Then that's it. That's basically it. What you need to fill out afterwards. The universities will then ask for an interview. The kind of questions they ask for an interview. Number one, why do you want to become a prescriber? Talk about policy, talk about your future, talk about helping the NHS, talk about making a difference in life. They're going to ask about clinical. They're going to ask, if you're doing hypertension, tell us about how you diagnose hypertension, how you treat hypertension, how you manage hypertension. They're going to ask you. If you're going to be doing earaches and ear infection or pneumonia, whatever it might be, tell us how you're going to treat that, what medicines you're going to use, tell us start to finish. So they expect you that's what they'll do in the interview. They'll ask you, tell us. They'll also ask you, how is your relationship with your DMP? How do you know him? What sort of course or structure do you have in place? How are you going to make it work? That's what they're going to ask you. Okay, that's what they're going to ask you. Another thing they're going to ask you is how will your arrangement work with your DMP? How often will you see him? How will you reflect on your practice? How is that going to work? That's another question that they love to ask. Other thing they're going to ask you is, how are you going to manage your time? How are you going to manage your time? They're going to ask you, how are you going to manage your time? So you've got to tell them that I've dedicated 20 minutes a day of regular study. I'm going to be regularly reflecting on my practice. I'm going to be reading articles. I'm going to be asking the doctors for questions. I'm going to be doing individual courses. They're going to ask all these things. Okay. So somebody asked, Caroline, how do I satisfy HEE that they're getting value for money spending on me? Easy. I told you, your scope of practice, do it in something that they're going to see value in. For example, minor illnesses. Whether you're a locum or not a locum, that's not the problem. The problem is when you pick something like, I want to do my prescribing in Botox. That's no benefit to the NHS. But if you said, Caroline, that I'm going to do my prescribing in a minor illness, like earaches, UTIs, perfect, because they want to rid that burden from GPs. That's why they think this is the real deal. The reason I said don't do chronic conditions if you're in community pharmacy, because you're not going to see patients with asthma that you're going to be able to diagnose. Come on. That when was the last time you saw a patient with asthma that you could diagnose and you could do not only peak flow meeting, you could do spirometry, and then after that, you wrote the prescription. In a GP practice, yes, but in a community pharmacy, it's not going to happen. So that's my point. Don't pick stuff like that. And also, when you're going to have to write essays, you're going to have to write things that you haven't done yet, because your essays will have to say, how did you assess the patients? What about the blood test reading? You're not taking any blood tests as a locum in a community pharmacy right now. You're not. So why put yourself through that? Why not do something you see all the time, a UTI, an earache, even like a chest infection, like a chest infection. If you want to do chest infection, like bronchitis, don't do pneumonia. You're not going to see pneumonia because pneumonia is going to be diagnosed on X-ray. You're not going to see that. So keep that in mind in terms of that. Woo! Guys, I think we've covered quite a lot of that I said we wanted to cover. So that's that good. Let's go back to my slides so I can get a bit more structure in place in terms of what is it that I need to do. You know what we could do at this point? What I could do at this point, I could open the floor up for all of you guys and I can answer any questions that you have to save time, because honestly, I've got a feeling I need a bit more time to go through this all. So why don't you all start writing your questions and I'll answer them. Let's do like a quick fire 15 minutes Q&A. And I'll go through stuff that that you might want that I've missed out here, because I've done here. Look at this. Look at my scope of practice. Look at this. Take a screenshot of this, guys. This is my scope of practice. Okay. This is what I wrote down, my scope of practice. Look how specific it is. Look how specific it is. Urinary tract. So you can't, your scope of practice can't be, I want to treat hypertension. Not good enough. I want to treat hypertension patients stages 1, 2, and 3, uncomplicated, no comorbidities, and age. It can't be, I want to treat somebody who's got a headache. I want to treat a chest infection. No, I want to treat patients who present with a chest infection, who are systemically well and are not toxic, this age group. So you have to write down exactly what you want to treat, what disease. Talk about the boundaries, talk about the age range, and mention if there's any comorbidities. I hope that's okay with you guys. Guys, write your questions in the Q&A. Or if you guys want to do it the other way, I'll let you lot speak. But if I let you lot speak, we might be here all day. That's why I'm not. Well, I'll tell you how much our programs are. Right. So far, I've gone through that. Think about the following in terms of what scope of practice. How many patients do you see? Are you going to be able to assess those patients? What can you prescribe? When do you prefer and why do you prefer that condition? Think about the benefits. So that's why I said don't do something like Botox. Do something like, if you're going to do hypertension, be honest with yourself. How many patients do I see with hypertension? Am I going to be able to assess that patient? Am I going to be able to prescribe? Maybe you can't do hypertension, but you could do something like a UTI. You could do something like an earache. You could do something like throat infection. You could do something like acne. You could be something like eczema. Does that make sense to you? I hope that makes sense to all of you guys, what I'm trying to explain to you. I hope that makes sense to you. Okay. So this is a bit about your, thinking about your scope of practice, how to do it. Yeah, we've gone through references, referees. I've done all of this. Easy, 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 easy. Right, look at this. Look at one of the requirements by the university. You've got background experience, 1 year qualified, you have advanced practice, and look at this. They're saying that you have assessment skills. Look at that. They're saying, do you have assessment skills? This is the requirements from universities now. It's not good enough for you just pick up and sign and up. Those days are long gone. Okay, they're realizing that actually this is probably not a good idea. And in terms of a typical university course, like in terms of what they teach, look what they're teaching. They're not teaching you clinical. Pharmacokinetics, pharmacodynamics, this is a typical university course. Typical university course. Drug interactions, adverse drug interactions, online assessment, prescribing for special groups, pretty much. Some universities are starting to do a bit more clinical skills and teach, but it's only short. As you can see, there's not a lot. Legal qualification, legalities, pain relief, pain, antibiotic prescribing. They're not teaching you how to diagnose. It's not their problem. They've already asked you that you're competent in your area. Why do we have to teach you how to diagnose? So you can see here, this is an example of a timetable. They're not teaching you how to diagnose. The courses are not teaching you how to diagnose. Okay. All right. What else do I have to cover? How to find a DMP we've done. Take a picture of this, guys. This is the email. Take a picture of this as an email that you could send. You could send to the doctors. I've done it for you. Before I move on, take a picture of this slide that I wrote. Look, I'm telling them stuff that I can do for them. I can help, I can save GP time. I can improve your this. I can take responsibility for you guys. I can train your staff up and so on and so on. So you can see I'm really trying to give value to them. We don't worry about the benefits of prescribing. Forget about what people have said about Medland. We don't have time for that right now. Where things have gone wrong. In terms of our course itself, so one of the students asked me what we do. Number one, we will organize a doctor for you. Number two, we will help you get into university. Number three, we will train you for 1 year start to finish on anatomy, physiology, pathophysiology, internal medicine, everything. And number four, we will then train you to become a trainer. In terms of costing itself, the whole course, excluding university fees, is £3,000. And out of that £3,000, what you're paying for is not to find a doctor. You're paying for the clinical skills training that we give. That includes a doctor and so on. And you don't have to pay up front. You can pay in installments. So most people put £1,000 deposit and the remaining is paid over 6 months. I'm happy to help you wherever you need the help. It's not a problem. That's how we do. Okay. And we will also help you get HEE funding. We will help you with that, give you the best opportunity to do that. That's what we do in a nutshell. We cover everything. It's you can even watch my medical videos if you wanted. So we're doing a lot of videos on medicine as well. So you can start to watch if you really like me and you want to know about histology, biochemistry, genetics. Our e-learning has everything. If you wanted to learn everything like a doctor, we'll teach you because I do that day in, day out anyway. So that we can do as well as a medical student, and primarily a lot of stuff that I do is make e-learning so we can help you with that. If you're a local member, you get a 10% discount. So the course is actually £2,700. So it's actually £300 discount if you're a local member. You don't have to pay up front. Like I said, it's £1,000 deposit. And even that deposit we can discuss as well. If you say, look, I don't have £1,000, I can be £203, no problem. But even if you don't want to come with us and you need advice, just get in touch. I don't have an issue with that. Get in touch. Get in touch. If you just want to get in touch and say, Fahim, look, I'm struggling. Give me advice, man. I don't know where to start. I don't know what help I need. Help me. There's my number. There's my number. Or send us a direct email or visit our website. You'll find everything on there. Right. Everybody, I'm so sorry that I've taken your time. I'm actually 10 minutes up. I have this webinar is being recorded, and I have also done a similar webinar in more depth on our YouTube channel. If you type in MEDLRN, it's in a lot more depth is there. Watch that one. I've spent about 2 hours on there. Okay, it's 2 hours I've spent. And you know what I'll do for you guys, because I'm a good guy, apparently. What I'll do for you, just hold on before you guys go. Just hold on before you guys go. Just hold your horses, like they say. Hold your horses. And let me find that webinar now, so I can show you. Because this is being recorded, but I wanted to show you. Guys, give me 1 second. I just want to see that this is definitely the one. I did one with look at a look. Yeah. Okay, look. I think it's this one. I think I've done many, but I'll show you lot now. Let me just share the screen. And oh no, not this. We're not sharing this. What we're sharing is this here. It's under here. How to become prescriber step by step. And I think I did one. Hey, thank you, Sadia. I think I also did. I think this is the one with locate a locum as well. This is the one that you want to find. So definitely this is the one. I want to find, I think this is the one. So under MedLearn, if you go under MedLearn and you go into videos, I have been a bit lazy with my YouTube. It must be this one because that was 2 months ago. That is the one. That is the one. This one. How to find a DMP and become a prescriber. So it's not this one, it's this one. Because this one was done with locate a locum. Definitely. Yes. Yes, this is the one. How to find a DMP and become a prescriber on YouTube. And this is, I spent 1 hour and I went through everything in depth. Hey, we had some comments as well. So this will definitely save time. It'll cover everything for you. Now tell me, does anybody have any burning questions that they want to ask me that before they go? I'm happy to mute the mic. Those of you need to go, you lot can go. So Innocent has asked, if I apply as a previous privately sponsored IP candidate to a university and gained admission, can I still secure funding from NHS within my course? I don't know what you mean by privately sponsored for IP candidate, but Health Education England will still fund you, yes. I don't know what you mean by privately sponsored, but if you mean that you're, yes, they should, Innocent, that should be fine. They don't have an issue with how you're funding your doctors or whatever. That's not a problem, okay? Anybody else got any questions, burning questions? Raise your hand, I can unmute you, or you can write it on the chat. Anybody wants to go can definitely go. Anybody wants to get in touch with me, I'm going to put this slide on so you lot can see this slide and you can get in touch. That's my number if you need me. Ines, anybody got any burning questions? No? No burning questions? Wow, really? You guys are done then. How many students does Medland take on and when? We take on close to 80, 90 students a cohort. Every semester we take on students. So for every month we take on students. That is what we do every month. So we have 80, 90 students. So we have doctors pretty much up and down the country. So we take on a lot of students every month. Like, I mean, we're working quite closely with Boots as well now because their pharmacists struggle to find DMPs. We're working quite closely with a lot of the universities. So as I mentioned, Lizzie Mills, the consultant who works with UCL, is on our clinical board. So, you know, we help a lot of students, 80, 90, loads. Right, anybody else got questions? Do you help to find a DMP? Toby, yes, we do help to find a DMP. Absolutely, we can organize. Do all universities do interviews? No, not all universities do interviews, some do. Because the university asked me if I would be self-sponsored or organization-sponsored. Write down self-sponsored, Innocent. If you're not organization-sponsored, self-sponsored. Right. Anybody got any of the burning questions? Yes, the £3,000 includes finding a DPP, supporting you for 1 year, helping you to get HEE funding, although I can't guarantee that, but we'll help you. Helping your application form, everything is included in that for 1 year. Okay? But it doesn't include university fees if you don't get the funding, because I don't give the funding, but you know, all my students this semester, or majority of them, got funding, all of them. Whew. Right, man, you lot have stayed with me for 1 hour. I love you lot. You know, I really appreciate that. So thank you very much. Thank you very much. Okay, I'm gonna go now, unless you've got any other questions to ask me desperately. Oh, you do. When I spoke with Manchester previously, they alluded to the fact that working in community pharmacy wasn't equivalent for the relevant community pharmacy they were looking for. Any thoughts on that? I don't agree with that, Mark. Get in touch with me. I definitely don't agree with that, but you have to be tactful how you apply. So get in touch with me, Mark. I can definitely help you. I don't agree with that. Absolutely. Why do you need to work in a GP practice to become a prescriber? That's not on. It's the way you come across and how you answer to them. Okay. Can you start at any time? Yes, you can start at any time, and we can help you with that any time. It says, Grace has asked, can we get a local DPP? The quicker you get in, the quicker I can organize someone local for you. We also do a hybrid approach where we do some online study and some face-to-face, so we can do that for you. Can I get admission in January? Yes, you can. Is Open University a good university for a course? I can't answer that question for you in terms of which university is good or bad. I can tell you my past experiences. Get in touch with me, send me a message. I'm happy to help you. But I can't answer that live in terms of, you know, I can't badmouth anyone. I can't do that. I think all universities are trying to help students. Some universities are more academically strong, some are more easier, some are, I think, have more experience in teaching pharmacists, but I can't categorically on live tell you what's a good or bad university because that's very subjective. So I can't do that, but get in touch and I'll answer that question for you. Can you apply to more than one? Yes. Summer, you have to apply to at least 4 or 5 universities to get a place. One is not enough. One is not enough. Which is the easiest university? Man, I can't answer that question. What's the easiest university, right? You want me to answer that question live? I can't answer that, can I? I'll still get in touch with me and I'm happy to answer that question. I can't answer that live. Is there a university that does total online without face-to-face? Salford University do, Robert Gordon University do. I think there's 2 or 3 other universities that do. When have I got until to pay 3,000 to Medlin? If you want to do the course for the next sitting, we support you for 6 months. If you sign up now, you pay a deposit of a couple of £100. We obviously, we normally ask for £1,000. The rest is paid when you start your course, and then you can pay over 6 months. Okay, money's not a problem. I'm happy to support you. Money's not the issue. I'm happy to support you with anything. That's not the issue. Okay, but we can do that. Are HE still awarding funding? Yes, they are. Yes, they are. They are still awarding by March 2023, but it's a first come first basis, guys. First come first basis. Okay, first come first basis. But the problem is that if you've lost out on the funding because you're taking too long, it's a problem. Get in touch. Let's get it done. I spoke to GPS today and he was happy to be my DP. Do you think I need to apply via your support? How much do I need to pay to my DMP? Look, Madia, give me a call. We'll get in touch. If you can get someone to do it for you, do it that way. Call me, I'll discuss it with you. Okay. Is there any university that does not have exam and only OSCEs? Yes, there are some universities that just do purely OSCEs. Get in touch. I can discuss that with you. In terms of your DMP, ask him, have you taught pharmacists before? Have you got a structure in place? Can you support me? That's what's going to be important. How does Medlin help with securing HE funding? How we help with securing HE funding is we're going to help you we're going to screen the students who I know, look, I explained that to you at the start. If you want funding and someone's paying for your course, everybody wants value in return. Simple as that. If your application is strong and we write it in a way that the universities can see benefit, you're more likely to get HE funding. Another way, for example, if you can't find a DMP and you can't fill out your application, you're not going to get funding anyway. You're not going to get funding anyway. So we will help you with that from start to finish in terms of getting HE funding, but we can't do it. Everybody, may God keep you happy. Thank you very much. I have a couple of exams to prepare for, so wish me luck, inshallah. And look, I want you guys to be the best versions of yourself. Just make a difference, guys. Irrespective of what you decide to do, get in touch. I'm more than happy to help you. I love you lot all. Peace out. I've got to go. God bless you. And I've given my number. Can we pay for a per service with Medlin, like only help with the personal statement? No. I'm not training you to get into university. I'm training you to be the best versions of yourself. That's something that we help with. We don't just pay bits and bobs and stuff like that, if that makes sense. We don't do that. Unfortunately, we don't do, right, here's 20 quid, I'll help you out a personal statement. It's not what we're looking for. We want you guys to be the best versions of yourself with everything. But if you want help, I'm more than happy to help. I wrote a blog about a personal statement as well. I'm happy to help where I can, inshallah. Okay. Okay, very useful. Thank you, Caroline. Get in touch. Everybody have a wonderful evening. Thank you for your time. I've left my number there. I'll leave it there. God bless you all. Take care.